Now, moving on, sticking with the topic of the dire standard of healthcare in this country and all the backlogs in the NHS, there's been a report out saying amongst the worst rated GP practices in England, as ranked by you, shock NHS analysis reveals just 1 in 10 patients are happy at their surgeries. I mean, I actually think that seems to be a lot. I've never met anybody who's happy with their doctor's surgery who can even get an appointment. This is actually from the Mail Online, and they've crunched data from the 2023 edition of the NHS GP Patient Surgery, which assessed the performance of the nation's 6,400-odd GP practices. Hundreds of thousands of patients were asked to rank how their practice fared. Nationally, satisfaction has plummeted to an all-time low, fuelled primarily by the appointments crisis that is frustrating Brits into essentially giving up trying to even see their doctor. Well, here to talk about all of this is Laurence Gerlis, who's a private GP from Same Day Doctor. Laurence, great to have you on the programme. I mean, are you rubbing your hands together with glee? Because this must mean more work for you.
It does, but, you know, it doesn't please me, Alex. I never come on these programmes and promote private practice. I'm a great believer in the principle of the NHS. I would just like it to work. So I don't take great joy out of this. It's been a horrible 3 years for patients accessing GP practice, starting, of course, with the pandemic. And despite what the GPs say, many GPs did close their doors. And I think a lot of the problems have come from that. We've seen this across many industries, that attitudes that formed during the pandemic have just stuck. And so people are having great difficulty getting appointments with their GP. There's still a lot of practices where you have to phone up at 8 a.m. and you're 30th, 40th in the queue, and then when you get through, there's no appointment. And what strikes me about this survey is the variation between practices. There was one practice where there were 1 in 10 people satisfied. Overall, I think it said that 71% of people thought their GP was good, but I'm wondering if they're actually asking people who have tried recently, or just the general public who may not even have tried to see their GP and just forming an impression. But general practice is in crisis. There's a shortage of doctors. There's a massive increase in demand for a whole variety of reasons, some of it inappropriate in my view, that I've said before, and I can't see an answer to it. And we've seen the hospital doctors go on strike. Do you know there are 30% more hospital doctors now than there were 10 years ago? But it's general practice where the real crisis is.
Yeah, why is that? Because we hear all the time, don't we, that people are leaving the GP workforce in droves. There's a really poor record of mental health among GPs. And yet a lot of people think, well, hold on. As a GP, you probably get slightly friendly hours. A lot of GPs are now part-time. It seems to be the go-to medical profession if you're a woman who wants to have children, because you can pick your hours a bit more. It's a bit more 9 to 5, that you're not having to, like, slice people open with all sorts of scalpels and tools and deal with, real sort of A&E level emergencies. And yet this seems to be the sector where most people who work in GP practice are saying is dreadful. I hate it. What's going on there?
Yeah, it is. I had to leave the NHS as a GP. It was the demand from the public, who treat you as public slaves, not even public servants. This is the paradox. I work now in private practice, and patients are respectful and they're not demanding. You think they'd be more demanding, but actually, when you work in a public service as an NHS GP, patients are more demanding, partly because they feel they've got to shout more to get their problem heard. So it is a very stressful job indeed. And I know that GPs are going to not like this, but you've hinted at the fact that part-timeism is part of the issue. GPs will say, well, I work 40 hours a week. Yes, but if it's only 3 days a week, then you're only providing a service 3 days a week. And bear in mind, GPs are not contracted to open at weekends. I've been working today. I've got colleagues working tomorrow. We're open 7 days a week. But GPs don't have to. So they cram the work into 5 days, and the doctors, some of them work 3 days, some of them work 4 days. And they're reasonably well paid compared, for example, with junior doctors, so they can afford to pay off their mortgage by working 3 days a week and maybe doing some private work on the side. So the structure is not ideal. Having said that, I'm not keen on NHS GPs moving to a salaried service, because I think that would open up all sorts of problems and costs for the NHS as well.
I mean, what is the solution to all this, Laurence? Because, you know, I've been trying to wrap my noggin around something ever since I left Belgium. I lived in Belgium for 3 years while I was rattling around that delightful institution, the European Parliament. And one thing I found is a lot of it's basically a private healthcare system over there, but it's always free at the point of entry. I think the European model is a pretty decent one, actually. And one thing they have there is real patient choice. And when I broke my ankle in Belgium, people would cross the street and say, oh, they're not a particularly sociable bunch otherwise, but people would cross the street and go, oh, what have you done to your leg? Where did you go? What was it like? And there was always this discussion of, oh, I've got a great surgery. My doctor's surgery has got an osteopath in there. It's got a physio. It's got a cardiologist. I phone up. I get an appointment the same day. I could easily just phone my doctor's surgery any point during the day. I didn't have to enter the 8 a.m. tombola. I had my GP's number in my mobile phone, and I could speak to her whenever I want. Why could that be done in Belgium, where there's a high population density, a huge migrant community? You've got NATO there, you've got the EU institutions there. They can do it, and yet here we can't. What is the difference? I don't get it.
Well, we can, Alex, if enough people want to. There's several problems with this discussion. When people talk about reforming the NHS, a lot of people say, oh, we don't want to be like America. They see as two alternatives, just the NHS or the American system, which clearly isn't the case, as you've just described. I've lived in Switzerland. I'm still registered as a doctor in France. And as you say, the European system is much better in many ways. We can do it. The problem I have, and I've had this discussion with people like yourself and on the media for many years, the public want better service, but actually the public will not want to pay to see a doctor. The government of any colour will not touch this because they know it's an electoral disaster. But most surprising of all, the doctors don't want it. I've been talking to colleagues for years about this, and unlike the dentists who, you know, do fill their wallets very rapidly, the doctors do not want to move to a fee-paying system. Now, I think there's a whole host of reasons for that. I think maybe some of them are perhaps scared of being in a competitive market. They like the guaranteed income that you get from being an NHS doctor. Bear in mind, good pension, guaranteed income. You don't have to especially please your patients or work especially hard. And I've always said it's up to the medical profession to lead this change, because no government will do it and the public need to be taken with you. Look, we've had 75 years of the NHS, and I'm afraid culturally it's just embedded. And you're right, it would be great to have a Swedish or a Belgian system, but getting to that point is going to take a revolution. It's not going to happen in the near future.
Well, Laurence, I think the revolution's starting, because essentially private medicine is here and here to stay. It's a huge growing sector in the UK because of the problems that we face. That is Laurence Gerlis, private GP from Same Day Doctor, talking a huge amount of common sense. And I want to hear your thoughts on this. I tell you what, if I broke my other ankle, I'd probably be minded to take my European health insurance card, my EHIC, get on the Eurostar and go to Brussels. It was great service over there.